20% of the population to being insured, because we have 300 million Americans, 32 million will get insurance. That's 11% of our population will be covered for 1/25 of what it costs the rest of health care. So again, people can say this $100 billion a year is expensive, but if you look at it the other way, it's going to be 1/25 of what we're spending right now. So is that cheap or is that expensive? The biggest problem, though, that I tell people, and this may seem pretty simple and pretty stupid comment, but it's how do we pay for the sick people? And sick people actually are 75% of the costs in healthcare. People with chronic diseases like diabetes, heart disease, lung diseases, they cost us a lot of money. People with cancer find it very expensive. I'm in the 55 to 65 age group, and do you know how big a percentage of us 55-year to 65-year-olds have chronic diseases? 41% of us have chronic diseases. So if you were having a chronic disease and you, for no fault of your own, lost your health insurance because you lost your job, you would not be able to get health insurance until this new law has been passed. So there are some good things in this bill that I think are really helpful. There are some not so good things, and we can talk about some of those too. So again, my summary is a little bit short, but I'll have some other comments too. So.
Well, I have a little bit different viewpoint on the healthcare reform bill, or law, the same thing, and that I don't think the law really gets to the heart of the problem, and that is increasing costs of healthcare. The insurance companies were taken to be the bad person in this whole thing. And what the insurance companies are now going to have to deal with is more taxes to the tune of $14.3 billion by 2018. There'll be new requirements that they will have to have as far as insurance, and that means that they can no longer cap per year what they pay out. A lot of insurance companies right now, their cap may be $2 million. 3 million, 5 million. They can no longer do that. They can no longer have annual caps on certain requirements, such as mental health has been in the past. They also are going to be required to spend a higher percentage on claims, paying out for claims that are presented when people are ill and utilize their insurance. And that means they're squeezing down what they can make. And a lot of the insurance companies right now are non-profit, but they do have to pay their employees. They do have to, pay agents, of which I am. And so there's a real squeeze as to how they are going to be able to afford these taxes. As well as paying for their administrative costs. And I don't think there's anything in the bill that's going to address that problem. And I think it becomes a very thin margin for the insurance companies to stay in business with all these requirements. In addition, as you probably all know, children who are under the age of 19, starting, and it depends on who you talk to, September 23rd of this year or October 1st of this year, that children will not be able to be taken, there will be no pre-existing conditions on that child, and so they have to be offered insurance. And this does not affect adults who are 19 and over until 2014. But with the 32 million that Dr. Kitchell said will be coming into the insurance marketplace, as he indicated, I have heard 48% will be eligible for Medicaid and the children's health insurance programs, which leaves 52% of the people to come into the insurance market, the private insurance market. And is that enough people who will be coming into the market to offset all the people who will no longer have a pre-existing? That remains to be seen. So predictions are by the insurance industry that costs are going to continue to go up. And if they continue to go up, eventually the government will most likely, in my opinion, this is my opinion, say, going to have a one-payer system. And then it's going to be, in my opinion, rationing of care. And there'll be less innovation and technology that will be generated from the private sector. And that will be not a good thing. But this is, I'm coming from the private sector part of this. I think it's very important, and Iowa has done a great job of getting more children covered by insurance through the Hawkeye program and through Medicaid, and that's a good thing. But it comes down to, is health insurance a right or is it an entitlement? And if anyone's watching what's happening in Greece, they are saying they have too many entitlements, and that is why they're in bankruptcy. And are we down that same path? I don't know. I hope not.
From a financial point of view, from a hospital perspective, that's what my sort of slant will be. Iowa has a 93% insured rate already. So to get from 93 to 95, the benefit to hospitals, theoretically would be that our bad debt would be lowered and our financial assistance costs would be lowered. But that represents about 5% of our business. In order to help pay for the $1 trillion initiative, hospitals have ponied up about $150 billion of that price tag. Basically through the reduction of future rate increases to hospitals. So for instance, if we were to get a 3% annual inflation increase at Mary Greeley, that increase is being threatened and potentially can go negative in the future, further out, years further out. What complicates this is that Medicare is about 45% of our business, and we are already losing $11.5 million on Medicare patients. So it's a significant sort of curve that's developing. And the reason we're losing $11.5 million is sort of during the Clinton administration, they did this exact same thing. So they took the annual cost and they reduced it by 1 to 2%. So while salaries and supplies go up 2 to 3, 4% a year, our revenue streams went up about 1% a year, and that curve just kept getting wider. We also lose over $1.5 million from Medicaid annually at the hospital. By the way, we have the second best quality in the country, which is amazing, and we have the 44th worst reimbursement from Medicare. So I can have the exact same procedure done in Illinois than in Iowa, and it could cost materially more in Illinois. And we have better